To live and let die. If assisted suicide should be an option for those who are terminally ill. I have seen not only my father pass away from terminally ill disease, but I've also worked in a healthcare setting such as home health, where I have been with those who have been with a terminally ill disease. I believe that patients who are dying should have the option to end their life on their own terms. Terminally ill patients who live with pain, not only that, the cost of living and having to choose the bare necessities and the cost of having to choose their treatments. At some point, we all have wondered the various ways we don't want to die, and they all lead to the same conclusion. We want to avoid pain, but what if we could avoid what? But what if we could make that a reality for a select individual? Receiving diagnosis of terminal illness is something no one wants to hear. We understand that often means a long and painful journey until the body eventually succumbs. A terminal illness is a condition expected to end in death. Example includes cancers, advanced heart disease, and organ failure. In 2024, an estimated 2,100,140 new cases of cancers will be diagnosed in the U.S., and 611,720 people will die from the disease. A person suffering from a terminal illness may live for days, weeks, months, or years. It is frequently determined by their diagnosis and any treatment they are receiving. Unfortunately, healthcare specialists can't always determine how long someone with a terminal condition will live. Terminal illnesses can take a toll on a person's body. Although there are treatments to help ease the pain, researchers have found severe daily pain in over 70% of over 20,000 participants studied. Nociceptive pain can usually be controlled with non-steroidal anti-inflammatory drugs or corticosteroids, whereas neuropathic pain responds to tricyclic and antidepressants or anticonvulsants. Relief or breakthrough pain requires administration of immediate release analgesic medication. Terminal illnesses may progress to a point where the patient is no longer able to communicate or describe the pain. This can result from an unresponsiveness due to organ system failure, cognitive impairments due to decreased cerebral perfusions or underlying dementia, delirium caused by terminal agitation or restlessness, and or physical impairments as seen with progressive muscular disease. Having pain management means extra doctor costs, home healthcare nurses, as well as all the prescription costs. This can take a financial toll on an individual. In some cases, terminally ill patients will have to make the decision whether or not to control their pain or buy groceries. We all know how expensive going to the doctor is, even with insurance. Could you imagine having to pay endless copays, home healthcare costs, hospital stays, on top of buying necessities in life? Hospital care costs in the last year of life averages $4,731. In the last month of life, hospital care costs can cost up to $32,379,000. $43,516 for initial care, $5,516 for continuing care, and $119,727 in the last year of life. The added expenses of having a terminal illness would be enough to make someone depressed, especially with the cost of everyday living. The average salary after taxes in the U.S. is $4,635, which is enough living expenses for 1.9 months. Everyone aspires to leave this world with dignity and respect. Perhaps assisted suicide could be a compassionate solution. Assisted suicide is with the assistance of another person, especially taken of the lethal drugs provided by a doctor for the purpose by a patient with terminal illness or incurable condition. In 2014, a California named Brittany Maynard was diagnosed with astrocytoma and became a spokesperson for the legalization of AID. She was a newlywed facing terminal illness, and her story quickly captured the public imagination. Her well-publicized death by lethal ingestion in Oregon in 2014 influenced her home state of California to legalize AID in 2015. To date, 9 states and the District of Columbia have legalized assisted suicide, with an additional state, Montana, allowing the practice in theory because of court ruling. The following states are included in the medically assisted suicide: California, Colorado, Hawaii, Maine, Montana, New Jersey, New Mexico, Oregon, Vermont, Washington, and Washington, D.C. However, Vermont and Oregon do not have a state residency requirement, which means that patients can travel to those and receive a lethal prescription to take their own life. On July 26, 1997, the U.S. Supreme Court unanimously upheld the decision. New York and Washington say that criminalized assisted suicide. Physician suicide, legalized Netherlands in February 1993, was largely opposed by the American medical establishment. Many practitioners believe that such actions violate the most basic tenet of medicine, which is do not harm, which they take an oath to do no harm. Discussing death is always a challenging and sensitive topic, especially when it involves terminal illness. It is an experience that many people find difficult to talk about, yet it's important to address and understand. Terminal illness brings about a unique set of emotions and challenges that should not be overlooked. Engaging in conversation about end-of-life care, the feelings of those altered and affected, and the impact of families is essential, as it allows for better support for preparation during such a profound time in one's life. Listening to and understanding the perspectives of both patients and their loved ones in life. Listening and understanding the perspectives of both the patients and their loved ones can foster compassion and empathy, making the discussion a vital aspect of coping with terminal illness. Unfortunately, death is an inevitable part of life that comes for everyone, regardless of whether we feel prepared for it or not. It arrives without warning, reminding us of the fragility of existence and the importance of cherishing our time with loved ones. No matter how we try to evade or delay in the reality, we must face this universal truth someday. Regardless of how deeply we desire a serene yet respectful end of life, the ultimate control over the moment does not rest with us. However, with the right support and assistance, we can explore the possibility of achieving a death that honors our wishes and embraces a sense of peace, even amidst the pain.